Jason, if you're talking, you are muted.
Oh, okay, perfect. Thank you for that. I appreciate it, Jamie. Hi there. Thank you for joining us for CAF's COVID Weekly Roundup. My name's Jason Belden, and I'm the Director of Emergency Preparedness with CAF. And had I not been on mute, you would have heard that for the second time. So I apologize for that. Today, we're going to cover AFLs. There's been a few of them. And we'll talk about where the AFLs are located, because if you've been looking for ones that have come out in 2021, they're in a different location. So we'll cover that. We'll talk about some vaccine issues with the Moderna vaccine, talk about CVS and Walgreens update. And then we'll talk about a grant incentive program through Southern California Edison. And I realize this might not apply to everybody, but it does apply to 100 or so facilities within the Southern California footprint, Edison footprint, and we'll cover that as well. So today is January 22nd. It's 1 o'clock in the afternoon. And as always, you can find resources from CAF. We collect all this stuff from different government agencies and collate them into one location on the coronavirus section of our website. All right, with that, let's get started. We've got our traditional preamble that we give to folks right before the webinar to let them know kind of the intent of the webinar, and to go over the fact that this is a grant-funded webinar. What we discuss on this webinar may not be CAF's official position, and I have no financial conflicts. We don't have any guest speakers this week. I wasn't able to get the folks from the fit testing video to be on this week, but I will have them on. I promise you that. As soon as I can get them on a Friday at 1 o'clock. So I appreciate your patience with that, but we will have them on for sure, and the video is almost done. And in terms of the intent of the webinars, we want to give you a situational report. And the reason why we do that is the better informed you are is a better ability for you to make decisions based on the most appropriate information. We'll talk about forecasting, where we see things going, and if we've identified best practices that you can incorporate, we'll pass those along as well. So in terms of the first update, there was a AFL 2101, so the first one of 2021. And this is the online application period for your patient needs waiver and workforce shortage waivers. Now, this is not related to the waivers in the pandemic, and I wouldn't necessarily cover this because it has nothing to do with the response. But there is a finite amount of time that you have to go in and fill out these waivers, and you need to do it annually. It's got to be done between the 1st of January and April 1st. If you don't get your waiver application in now, it won't be accepted if it's received after April 1st. So you've got to kind of balance that and get that done if you need those waivers. All right, let's talk about the process for fit testing resource requests. I know there's been a lot of, I've gotten emails from folks saying that MOACs are declining this request. And I think this is a classic issue of the left and right not knowing what's happening. The MOAC programs, the easiest way to explain this is the MOAC programs are run by the EMS agency for the state of California, and they're not connected to CDPH. We like to think that they work in conjunction with each other, but oftentimes during this response, we've seen CDPH direct you to go to the MOAC, but they haven't let the MOAC program know that these requests will be coming in and what to do with those requests. And so we made a request of Heidi, could you please let the EMS agency know to filter down to all their MOACs so that everybody's aware that this process exists. So hopefully that will resolve some of the issues where you're declined right away with the resource request. If you're in conversations with your MOACs, I would provide them a copy of the AFL so they see what it is. The MOAC themselves are not providing any of these services. They're just a pass-through to get the state to give you the authorization form. And then once you get that authorization form, you're going to have to find a location that Concentra does business, and then you're going to have to follow all the requirements for Concentra in order for you to utilize that program. And that means you're going to have to go to their location. This is not a service. At least I've been led to believe it's not a service that's going to come to you. You would have to send your staff to them. Consequently, though, it does allow them to perform medical evaluations on top of the fit testing. So if you want them to do that as a part of the service, Concentra will provide you the medical evaluations. Your responsibility is just to make sure the forms are complete prior to the employee showing up at the location. And then when the employee goes to the location, they have to have at least 2 types of respirators to fit test. So there's some limitations to this program, but certainly if you're locally close to one of those Concentra locations, certainly it offers an ability to get some of your staff fit tested. So it's not a perfect solution, but at this time, it's likely to be the best that we can get from the state. So if you are struggling to find those resources, at least give this a shot. So. All right, now I want to talk about AFL 2106. This is another AFL that came out this year. And this is just a survey on the use of IDT teams for unrepresented residents. It's not a very long survey, and the survey is going to be used to determine the scope of need of an independent patient representative. So you may see CAF send this out via email, but in any case, if you want, the link to the SurveyMonkey is right there. I don't know, it should take you maybe 10 minutes. They're not looking for super specific information. They're more looking at ranges of how many patients fall within certain categories. So you should be able to get that one done pretty quickly. And hopefully we can give them enough data to be able to make informed decisions on how to go forward with IDT. So. All right, I mentioned that the AFL locations had been switched, and if you're like me and you like to bookmark things to be able to refer back to them, I wanted to give you the 2 separate links so that you have those so you can refer back to them. And the way that it works is, so those AFLs that came out in 2020, even as they get updated in 2021, they'll still be housed on that 2020 page. And obviously you get used to how they number them. It's 20 dash whatever the number is, and then 0.1, 2, 3, 4, whatever it is, that's the version. So if you're looking for information on 2020 AFLs, they're located at that link, and the new AFLs that originated in 2021 will be on this different page here. So I wanted to make you guys aware of that, so you wouldn't be able to go searching for it. And if you do a Google search like I did for 2021 AFLs, it does not come up. So it's kind of difficult to locate. All right, so I want to talk for a little bit about the Moderna issue that you may have heard in the news. There was a pause in the distribution of a significant number of the Moderna doses. There was a lot that was associated with a rapid succession of adverse events in San Diego. It was 6 adverse events in a really short period of time, and there was 1 adverse event on the night before. So in total, there were 7 cases of moderate side effects in a short time frame. All the cases were resolved with on-site intervention, so nobody required hospitalization from that specific event. The California Department of Public Health released a Western states review of the vaccine and what they determined after that. I included that in the handouts for today. Not much information was contained within the actual report about, what were the clinical presentations of the people, was it anaphylaxis, or what other conditions were reported. Sadly, it wasn't very well detailed, but they did reiterate in their review that importance of observation is important. Well, that sounds silly, but the point is, they have identified that there is a real need to have an observation period afterwards. And so the main thing to understand is there is a very small percentage of folks that will have negative effects from this, but they could be serious if they're not observed and we don't do interventions to be able to minimize that. So part of the reason why they resumed vaccination and using the same lot is that in other states, they did not pause distribution of the vaccination, and they have had quite a bit of other data to be able to see that there were no other similar issues. And they didn't make it a judgment in the thing whether it was whether these were 6 or 7 cases that were all indicative of anaphylaxis and things like that. They didn't draw that comparison. But I will say that this morning, the CDC released I'm not certain if you guys pay attention to these, but they released the morbidity report for, well, it's, gosh, here, I'll give you the exact title. So allergic reactions, including anaphylaxis after receipt of the first dose of Moderna vaccine. And so if you go to the MMWRs on the CDC page, it has a breakdown of all the cases within the Moderna vaccine. And just for your knowledge, currently there's been over 4 million of the first doses of the Moderna vaccine. And in 9 cases, onset occurred within 15 minutes of vaccination. No anaphylaxis related deaths were reported. And it goes on to state a number of things. I always think for your clinicians, this is really good to take a look at. Most of these large kind of conditions, they're doing hundreds or even thousands of people at a time. And so we get to see a really small percentage kind of get this outsized response to it. I did want to point out that as of January 10th, out of the 4 million doses, there's been reported to the VAERS system, there's been 1,266 cases of adverse events, meaning anything from fever and things like that, all the way up to anaphylactic shock. Among those, 108 of the cases reported were identified as possible cases of severe allergic reaction. So we're talking about a 0.03%. So yes, there will be adverse events, but it is at a very minimal rate, and it is consistent with the data that was included in the EUA. So we're not seeing anything outsized from that. And I think in California, we paused the distribution of the vaccine and out of an abundance of caution. No other states did that. We did that, but now CDPH has basically said, if you have paused and you, as a result of that, please resume doing your vaccination. So I just wanted to let folks know that that's all great news for us. It sounds like if you were involved in that, especially if you're in Los Angeles County, you're ready to go with your remainder of your doses. All right, so that's the Moderna issue. In terms of the vaccine update, hopefully you guys had a chance to pay attention to or tune into the HSAG webinar on Wednesday. HSAG records their webinars. If you're ever interested in where to find those, the AFL 2051 has a link within that AFL that takes you right to the HSAG page. I looked yesterday for the actual link to the recording, and they had not had it up yesterday. Otherwise, I would have put the link in here, but definitely check back for that. If you did not listen to that and you're participating in the CVS and Walgreens program, I suggest going back and listen to it. There were a few things that maybe may assist you in future doses or future clinics. They did confirm that most of the providers were well into their clinics, and they only had a few that had not started. I believe Walgreens and CVS both mentioned that they anticipated having the first clinic resolved for everybody in their program by the end of next week, I think. So that's all great news. They were confident in their supply of the vaccine. As you guys pay attention to the news, you know that vaccine distribution in the general community is all over the board, and supply is really tight. And as there's a big rush by the public to get vaccinated, whether it's just members of the public or it's other stakeholders, kind of essential workers and police and fire, law enforcement, teachers, everybody else is putting an immense amount of public pressure on our local health departments to be able to open up those vaccine supplies so that their stakeholders can get vaccinated. And what that does is it's definitely put a constriction on the supply. And while we were confident that there would be an initial supply enough to meet the needs of the folks in skilled nursing facilities, I think what's become clear is that once we get done with these clinics, we may not be in a great place for ongoing vaccination doses unless the supply side really catches up with the demand. And right now, that public pressure constricting that supply may affect those of your staff or residents who choose to wait to be vaccinated. So as you have conversations with your staff or your residents, I think one of the things you want to say is, okay, you choose not to get the vaccine now. If after a week from now and you choose to get the vaccine, we may have issues locating supply for you, especially if it's after you've conducted your vaccination clinics with CVS and Walgreens. Anyways, that is really important for us to keep an eye on, and we want to make our employees aware we may not get this shot again, and if we do, it may be a different vaccine that's less efficacious. There's a lot of unknowns with waiting. What we do know is we fought tooth and nail very hard as an industry and a profession to make sure that we were first, and we want. But once we're done, there's a real desire, especially CVS and Walgreens. I mean, they have a big chunk to go after they're done with us. The assisted living folks are going to really struggle with this because they're coming after us. So now they were very, very clear about this requirement to have residents return for the second dose. They were clear that they don't have the ability to be able to send people to a resident's house or another place to get them vaccinated. And the CVS and Walgreens stores, I think eventually will have the vaccine, but I don't know if it's going to be soon enough to be able to meet those second dose needs. So really going to have to work on getting your residents to return for that second dose. There are other options, and I realize this can't be a one-size-fits-all solution. For those other options, you're going to have to consider possibly partnering up with your local health department to make sure that they can identify how we can get that person the second dose. Maybe there's an acute hospital close to where that patient lives. And the other thing is, if you're in a managed care area, you may talk to your health plan to see if they have options to help their plan members get vaccinated. So those are all different options that you can reach out to help that person get their second dose. But if you're part of the CVS and Walgreens program, the expectation is that that resident return if they want to get their second dose as a part of the CVS and Walgreens program. In terms of the operational impacts, they've all been consistent with what we've heard. I think the breakdown is we need 5 administrative staff to do, all the paperwork, and we need 1 staff to do the shots. And so it's kind of like, it's a 5-to-1 administrative time versus the time it actually takes to put the shots in the arms. That's consistent with what we've heard. We've heard staff call-offs in the 1 to 5% range. So between 1 and 5% of staff have had symptoms significant enough that they would miss a day of work or 2 days of work. Still very consistent with what the EUA said, but it also says, okay, gosh, it was consistent with what we understood going into this. 1 to 5% would have moderate side effects that could cause them to miss work. We anticipate that percentage to, if it's consistent with the EUA, it doubled during the time of the second dose. So if you were in 1 to 5% of your staff struggled with symptoms, expect that range to be in the 5 to 10% range with the second dose. And that's consistent with what the EUA says. We're hopeful that the time and the symptoms can be moderated with Advil and things like that, and we can get folks to work. But we don't know that yet. As folks start their second doses, I encourage you to reach out, especially if you have experiences that are inconsistent with what we expect. We definitely want to know about those with side effects, things like that. Enter those into the VAERS system, reach out to your health department and let them know. And then I wanted to just pose a quick question here. Nothing in concrete or a poll question or anything like that, but just if you could, in the chat box, if you could list out your experience with percentages of acceptance. If you had kind of a general idea of how many of your staff are taking the vaccine and how many of your residents are taking the vaccine. And I talked to a facility yesterday that had higher acceptance rates in their staff than they did with their residents, which was a little concerning. But it leads me to the question, are residents struggling with this? And we had been under the assumption that they were chomping at the bit to get vaccinated. And so what are the things you guys are hearing or seeing in the field? I'm going to open up the chat box before I move to the next thing here and see if I've got anybody that putting numbers in here. So, all right. So 100% of residents and 45% of staff, 75% of staff and residents, 80% of staff, 95% of the residents. Wow, you guys are doing fantastic. The staff is the one we were concerned about. And the residents we thought was more consistent, that folks would get the vaccination. And I will say that just anecdotally, we've heard that the symptoms are actually more impactful the younger you are. I don't know if that's bearing out to be true, but it seems like we're not hearing as many moderate or mild side effects in residents. So that's good news. All right. So in 40 to 60% of residents or staff, I'm assuming that is. All right. Well, I think you guys are doing well. I think the consistent kind of theme here is somewhere between 40 and 80% of staff are getting the vaccine. Some of you guys are way higher than that on staff, and you ought to give yourself a pat on the back. That's pretty darn good. I will say that just because you only have 40% of your staff, and it may have to do with your staff mix. I mean, clearly there are cultural differences in how vaccine is viewed in our society, and maybe you have culturally different staff members that may view vaccine differently. And so that's to be, well, it's what we expected. We hope we can do better, and we'll still work on getting the education out to the staff. I think as folks see less people having, and the vast majority, when we talk about 0.03% are having bad reactions, it's a really small number when you compare it to the millions of people that are not. So we've got to work on helping people around that. We don't know what the metrics are that CEPH or CDC are going to say in order to reduce infection prevention or infection control measures. How many of your staff or how many of your residents will need to be vaccinated in order for us to essentially say it's okay for you to resume normal operations. But we anticipate we're going to have to drive that number up. So if you've got staff, we've got to work on strategies on getting them higher vaccination rates. And we'll work on that. But I think as you guys go, explore options to do that. So, all right, I want to get to the update on Los Angeles County, because as well as CVS and Walgreens are doing, we're not as confident that Los Angeles is going as well. Los Angeles provides a vaccine distribution site where you can look to see how many facilities, not just SNFs, but all healthcare facilities have received vaccine and given out doses. That update has, or that site has not been updated in weeks. And I can't gather any information from the public health department there as to kind of the numbers of facilities that have already received their doses. The last word we got was somewhere in the neighborhood of 220 out of 340. So we have concerns because we just don't know how many of you guys are left out there that have not even started. We have second dose concerns, and I know I've been reached out to by a number of providers that have said, you know, I did my first vaccine the day after Christmas, and I'm 26 days into my 28 days later, and I still don't have second dose vaccines. For those folks, we contacted the Department of Public Health, and we said, we need answers to this. These folks are going to need to start doing shots in a couple of days here. So night before last, the Department of Public Health said that they would be shipping out vaccine to those close for their date. So they have a list of everybody on the date that they picked up their doses. And then they, you know, their plan is to ship them to you 21 days after that first date. Now, I realize some of you guys are past that. They did indicate that they will be shipping those out. Well, they told us that Wednesday night, so they should have been shipped out yesterday. Hopefully that means that some of you guys have received those doses. If you're not receiving a second dose, please let me know. And then also let me know how close you are, you know, to the 28th day. Now, for those of you that used under 100 doses during your first clinic, we've been told that you will need to pick up your second doses from Los Angeles County in the same manner in which you picked it up the first time. They did not say whether they would be messaging that out to the providers. I certainly hope so. I asked them to send it out in a LA HON so that you guys would all get the information, but I don't know if they sent that out. I have not seen it on the LA Health Alert Network yet. Ongoing supply constraints past that are still uncertain for ongoing vaccinations. And these are lessons that the remainder of the state can learn, because once the CVS and Walgreens program is done, guys, we're all going to be in the same boat as Los Angeles. And we're going to be talking about how do we obtain vaccination ongoing. And then if you are in Los Angeles houses all their information as to what you need to do on their vaccine checklist website. And that website changes quite frequently. So it's important to monitor it almost daily to make sure that you're understanding any changes. There was a change to, obviously we know COVID Ready went the way of the dodo bird, and they replaced it with CalVax. And then CalVax has specific information you need to do in order to get set up. You've got to go in and assign yourself a new password and things like that. So as you go through your vaccine distribution administration, make sure that you're monitoring that website for any changes. All right. So that is all with Los Angeles County, and hopefully we'll have lots of time for questions after this as well. I just want to cover this for a second, and I know this doesn't apply to everybody, but you got to forgive me, guys. We have a really short time frame if you want to qualify for this incentive program. So if you're in Southern California Edison territory, meaning you get your utilities from SoCal Edison, I think SoCal Gas, and Los Angeles DWP. So if you're in any of those three groups and your facility is in one of the tier 2 or tier 3 fire areas, the California Public Utilities Commission has a map. You can click on that link there. It'll pull up a fire map. You just want to toggle tier 2 and tier 3 and see if the city in which your facility is in falls in that area. If you do, then you qualify for the self-generation incentive program from Southern California Edison. There are similar programs with San Diego Gas and Electric and Pacific Gas and Electric, but the amount of dollars and the grant dollars available are not as substantial as they are for SoCal Edison. In the SoCal Edison footprint, they have other factors based on the, kind of the neighborhood or neighborhood factors, they want to increase the ability to help facilities in well, let's just say, all kinds of areas. So they want to not just folks that are in the most wealthy of areas. They want to concentrate on areas that are impoverished or don't have as much infrastructure. But that's in addition to that. What it means is that there's a big pot of money for self-generation. And self-generation can really be done in two ways they're looking at now, and that is solar and battery power and thermal energy storage. And both of them can be installed in facilities. If you have a question about this, and probably the best person to have listen to this webinar is to have your maintenance staff to listen to it. But we will be having a webinar from a vendor that on Tuesday that talks about the application process, and then kind of the technologies around this. And essentially what it's designed to do is to give your building some resilience from public safety power shutoffs. If you've been subject to that, or you get our notes on you're going to have your power shut off, this is definitely something that's interesting to you. The applications are going to be due the first week of February, and that's why we want to get this in. We have to compete with these dollars with the hospitals and other critical infrastructure. So we're not the only ones going after the dollars. There are tons of vendors that can assist you with this. We're just going to have one person come on the webinar on Tuesday. I attached a vendor list. If you're in that those fire threat areas, my suggestion is download that vendor list, take a look at it, and see if there's anybody on there that you're thinking you would like to do business with, and we can try to contact them. I will say that if it was me and I was looking at participating in this program, I would pick one of those vendors off that list that can do design builds. So you agree on a price per kilowatt hour to have this done. That price is within the grant budget, and then all the overage and all the OSHPD work and everything else goes to that contractor. That's what I think is most kind of interesting to you guys is we can have all this done, and we can have OSHPD done, and we can create a more resilient emergency power infrastructure within our building. So all good stuff. I encourage you to take advantage of this while the opportunity exists. The PG&E program, the dollars were essentially gone within a week of the program opening up. So we don't have a bunch of time. That's why I wanted to put this in front of you guys now. So, all right. So we had a really short agenda. I don't want to keep you guys forever. I'm going to hop to questions, and then we'll go through these questions. And I've got somebody capturing all this information. So if for some reason we don't get to all this, I'll definitely answer these questions on the next go round or put them in the CAF webinar. I also put the notes for the CDPH HSAG calls on there so that you have that and you don't have to go download it from their website. But the notes have the answers from the CVS and Walgreens folks in detail if you have questions about their presentation. So, all right. Have you heard something about, let me expand this real quick. I'm hopped to. Oh, have you heard, first question, have you heard something about the state resuming recertification surveys? And no, we've not. We anticipate that's going to be probably fairly soon, maybe in May. I, I'm guessing here, I don't know specifically, that the public health emergency runs through April now. And my guess is they're not going to change IPs. The current surveys are doing until after the public health emergency ends, but I don't know that for certain. I think it's safe to assume that it's going to continue the way it is for a while, until probably at least April. But that's my guess. I don't know. I don't have any certainty, and tomorrow that could be changed, but I think it's probably close to that. All right, next question. So I am so happy to see really high numbers of folks getting vaccinated. That is such great news. And hopefully you guys have got your vaccination and all you had was a sore arm or maybe a headache the next day. So, all right. For second dose allocation issue, we gave more first doses than what was approved for our second dose allocation. Okay, that's a great problem. That was a statement by Michael. Michael, can you do me a favor and put your email address into the question box? I want to follow up with you so that we can find out where your facility is and talk to the health department and about getting that second dose. So we were told that the second dose could be administered up to five weeks after the first dose if needed. Is that true? Well, I've heard physicians from the LA Health Department say that. I've not seen it in writing, I generally don't. I don't believe it unless it's in writing. I go, that's great. You said it. Now can we have it in some kind of guidance document so that we're protected for that? Personally, I don't think it's hugely different if it's 28 days or 35 days. But I don't know that for sure. And certainly the EUA is based on a very strict criteria. That the physicians all felt that it would be okay, but like I said, without it in writing, I would be concerned about acting on it without it in writing. Is the second dose the same content as the first? I asked because some sister facility received their vaccine earlier than us. Oops, sorry, I messed this up here and I lost the question. Forgive me. So could I send my extra to a sister facility to start their second dose before my first doses expire? Yes. Well, I can't say whether you should send it to the other facility. If the other facility is across county lines, the counties would not be okay with that. But as long as we're within county lines, I think that would be encouraged, actually. We've talked to Los Angeles, and in Los Angeles, as long as it stays within the county, they're okay with that. But and you're following the same kind of criteria for who you're giving the vaccine to. But the second dose, the contents are the same. So as long as you're using Moderna, it's the same first and second. Just don't mix Moderna and Pfizer. Those are the two we don't want to do. Okay. All right. I actually think we've run to the end of questions here. If anybody has any further questions, please post-COVID 20 days and less than 90, no symptoms, returning from acute or sniff, need to isolate. Well, the rule is in the yellow zone, all new admissions go into that yellow zone. But if this is a returning person and they're post-COVID 20 days, in less than 90 days, no symptoms. I mean, me personally, that clearly is somebody that could go right into a green zone, but I can't make that determination. I don't know that if that's consistent with what CDPH is kind of put out there. I would say that person clearly could go into the green zone, but you'd want to confirm that with your health department. Yeah, okay, so they can't decide either. Uh, to me, it's a no-brainer. We've already completed the isolation period, and we know that they're going to test positive, for 90 days. We're not even going to retest those folks. I don't know. Now, I guess there's some nuance to that. If that person is, has struggled with symptoms for a long period of time, it's possible that they could be contagious after 20 days, but it's highly, highly unlikely. So I think that's the discussions I would have with the public health nurse. I would just say, look, if the person was in our building and they had done those 20 days in our building in the yellow zone, they would go into the green zone. So what's the difference if they did those 20 days at the acute? To me, it doesn't. It really makes no sense. Obviously, that's a unique situation, and I think that person could go right into the green zone, but I don't get to make those determinations. That would have to be done by that public health nurse. So says isolate 5 days. I think, that's fine. It's one of those things as a operator, you just go, okay, I'm just going to do it, and I'll get over it. It doesn't make sense. It's probably inconsistent with what's best for the resident. But if that's all I can do, I'll work with the 5-day thing, and that's what I would do. So, all right, guys, I want to say thank you very much. We've had some time to talk about recovery. We do have a recovery work group. We've got just a ton of work to do in terms of how we advocate on your behalf. We'll be discussing that over the coming weeks. Sadly, I think that there's a real quick move to implement infection control measures based on patient or resident safety. There's not going to be a real quick move, to remove some of these things. And so we've got to identify data points that we think are best to indicate safety. And it's going to take some work for us to get that done. But that's what CAF's going to be working on in next week. My hope is by the time we talk to you next week, every single facility has been visited within the state and has had at least one vaccine clinic. So, and take some time this weekend, listen to some music, work on some recovery for yourself, read a book, work out, do something different that's not COVID. I'm speaking to myself as well as you guys. So hopefully you have a great weekend. I want to say thank you to Jamie and to Summer. Oh gosh, you know what? Before we leave, Summer, can you introduce yourself?
Of course, yeah. Hi, everybody. I'm Summer Brazell. I'm going to be the disaster preparedness coordinator, so you guys will be hearing from me.
Awesome. Thank you, Summer. And so many of you knew Courtney before. Courtney went to go work for CAL FIRE. She left us for, much more stress in the CAL FIRE world. But Summer is going to take over from Courtney, and she's going to be the program coordinator. And as we go forward in our educational offerings for the disaster preparedness program, you'll see a lot more of Summer in the time to come. So appreciate you guys hanging out with us. Have a great weekend, guys. Take care.